Hello, everyone. So my name is Robert John Pace, and this is my presentation, Effective Crisis Management in Social Work Practice. Definitely a key. It is interesting to me as well. So one of the reasons why I chose this, because I myself, I want to get more adept. I work in substance use, and that's pretty much been the bulk of my social work career. And so I want to better help my future clients and also my current clients in any crisis situation that they may face. So here we go. So, crisis management, it's essential for supporting vulnerable populations during challenging situations. And of course, that can take a number of different faces, but ideally, the populations we work with are vulnerable, and we want to help alleviate any cause or concern that they have and work in our capacity, right? So, effective crisis intervention can prevent long-term trauma and promote resilience. Again, we're here to inspire, we're here to promote resilience. Um, we're here to, to shine a light on our clients' strengths. You know, Even if they think that they don't have strengths or resilience, the fact is some of our clients have been through the most stuff, have the most resilience and the best coping strategies. They just aren't aware of those or don't have the confidence to utilize them. So that's our job, right? So, of course, today I'm going to explore strategies for crisis management through a social work lens. That's what we do. I have this quote here from Andy Gilman. The secret of crisis management is not good versus bad. It's preventing the bad from getting worse. And now that's the antithesis of what we do. It's not malfeasance. We don't want to do any harm. So it's not okay, this is bad. Let's bring this good stuff in. I don't want this client to get any worse. I don't want their situation to get any worse. I don't want anything bad to happen. Or putting fires out, if that makes any sense. So, what is crisis management and why should we study it? That's a very good question. You know, um, it boils down to this. It's focused assistance provide individuals, families, communities providing an acute crisis, again, those vulnerable populations, whatever that population may be. The goals are basically to do this: stabilize, reduce stress, assess, mobilize coping strategies, connect, and prevent deterioration. And deterioration, basically, in this context, is we don't want their situation to become worse. Again, non-malfeasance. We're chartered to do no harm, and therefore, anything that we can do, particularly with crisis management, we would like to prevent that, right? Stabilization, especially working with like mental health populations, be that via medication, environment, hospitalization, what have you, a combination of those things is stabilization to so that interventions that we're going to take in the future will take, and they'll be more effective that way. Of course, we're constantly trying to reduce stress in our clients as well as ourselves, and also assess. We also want to mobilize, again, build to that resiliency of those individuals and find out what kind of coping skills they already have, because rest assured they have some. And also, we want to connect them to the services that they require. Now, if we cannot meet their needs or it's beyond our scope of practice, of course, that's when we connect. But of course, we would like to do the best that we can with what we have. According to Hussein Ashcroft here, currently there is an absence of literature on social work leadership skills for effective practice in healthcare and mental health settings during times of crisis. And again, you know, those of us that are in our communities, especially working with our clients, we have this power dynamic that we're seen as the experts. And so I thought this was real interesting that there is an absence of literature on these sort of skills that we as social workers can partake during times of crises, right? So that's one of those things where it's very, very key. And also, it's kind of caught there, unfortunately, but social workers have had a long-standing history of working with communities and individuals during crises, of course. We collaborate. That's what we do. So, in choosing the topic with AI support, this is where AI definitely came into in clutch here. So, I had three possible topics that were generated: crisis intervention strategy and social work, kind of a broad topic there, managing trauma during a crisis, and building resilience in a crisis. So what I decided to select is building resilience, or focus on is building resilience in a crisis situation. And also I used Claude AI was the tool I used. I found that one to be the most user friendly and also the most effective for my uses so far. So One of the main things and reasons why, and what we want to focus on, is developing emotional regulation skills, not just in ourselves to be able to work with these clients during some of their hardest times, but also to promote those regulation skills within those clients. So it can take the form of this: stress management, like mindfulness, deep breathing, journaling. Many times we tell our clients, hey, journal, be mindful of the situations. Tell me what you see around the room. Help them to think. Count to 10. So learn to recognize and manage emotional triggers to maintain composure under pressure. And again, this goes both ways. So not only do we have to understand and realize what our triggers are and recognize what those triggers are, we have to promote that with our clients as well, because you cannot maintain composure, you cannot utilize ways to diffuse triggers if you don't know what your triggers are. So not just for substance use, not just for mental health symptoms, but also for stress. Times of crisis are extremely stressful. So these are really key. So according to Bretneff, as cited in Jelani 2022, a clinician's demeanor, attitude, and ability to take the lead have a direct impact on reducing tension in a high-risk situation. So we have that charge where we can make the difference. We can either exacerbate the situation or we can make it worse. Or we can make it better. And it boils down to our demeanor, our attitude. So again, that self-reflection aspect of our jobs of being a social worker comes in key here. So boosting resilience, according to Paul and Hosami, 2025, during complex emergencies, good social work, quote unquote, I would say effective social work, practice considers and incorporates cultural aspects such as spirituality and stigma. Again, we're playing to our client's strengths, be it spirituality, be it maybe a stigma that they have culturally, and then we can work around that, utilizing that. Things that they may seem as barriers may be key to boosting their resilience. And of course, I'm one to consider the strengths-based perspective. I'm huge on that. We can utilize the identified strengths from our clients to help them find the tools needed in a crisis situation. Many times, clients have the tools. We just have to not coax it out of them, but we have to empower them to be able to use them, to realize that, hey, you have been using these tools all along. It may seem like the end of the world now, but I'm here to help you through this time, to hold your hand through this time. The most damaging psychosocial effects of crises are the destruction of support networks and protection that they provide. So that's key. So again, we need to help build those support networks with that client and offer some sort of protection. You know, of course, when we understand this, we can empower clients to utilize any resources available and to bolster and empower even clients that seem ambivalent. A lot of times clients are like, I don't know what I can do, or I don't necessarily want to do anything about this. I just want to X, Y, or Z. We have to have a lot of empathy with those clients, and we have to also, again, self-reflect and look at ourselves and our own reactions and our own triggers and to best help them, because that's what it's about in the end of the day, is helping the client. So strengthen support networks, kind of piggybacking off that. So cultivating relationships with family, friends, colleagues, or mentors who provide encouragement and perspective. So again, we want to involve everyone that this client will allow us to in order to best help this person go through what they go through. Again, add to their strengths. They may seem reluctant to want to go to family, to go to friends, to go to colleagues. Oh, it's not really their problem. Well, these people care about them and they maybe want to help. And so we need to empower them and show them that, hey, it's okay. You can ask for help. In fact, you're asking for help right now just by talking to me. Of course, participate in community or organizational support systems to avoid isolation during crises. That is key. Typically, a lot of times our clients have to isolate, which is the worst thing, is to be in your own head. That's where, that's where bad stuff happens. Bad stuff starts. And so we want to, support that via our organization, via the community, seek out and see what they can utilize. So of course, in working with communities, which we do, we collaborate. That's what we do. One of the many hats that we wear. Social workers can utilize their broad knowledge and acceptance to uncertainty to empower them, from within. We need to do that. That's where the real change will come from with our clients is from within. So one of the benefits of good crisis management, especially in a social work, you know, um, area, is enhancing adaptability and problem solving. Helps you to stay flexible and open to changes when facing unexpected challenges. Human beings, we typically don't like change. Our clients are no different, and so change is going to happen. It's a fact of life, and when that happens, having that added flexibility, especially you as a counselor, is going to help you be more effective. So, of course, it helps you develop problem-solving and decision-making strategies to respond effectively in uncertain situations. Uncertainty, oh, it's terrifying. It's terrifying for us. It's terrifying for our clients. But being comfortable with being uncomfortable, helping to foster a an atmosphere of that, be key. So again, COVID-19 was a very, very hard time for a lot of people, and particularly for us. It encourages us to think outside the box. You know, there's no cookie cutter way of working with the client. Theory is great, but when it comes to working with somebody, no one theory necessarily will do, and so we need to think outside the box and utilize our creativity, and also draw from our past experiences what helped, what didn't help. So engagement. So if there was I was presenting in front of a class, I would ask them, in your own terms, so what does crisis management mean to you? In your own words. And also, how does it apply to your social work practice? How does it look like at your agency? How does it look like when you're working with your clients? So in conclusion, crisis intervention is time-sensitive, goal-focused work that can be transformative. It can change people's lives, man. Effective crisis management balances immediate safety with empowerment. Again, that's the key. Do no harm. We want immediate safety. We want to make sure that this client's going to be safe when they're with me and also when they leave. Crises are opportunities. As much as they suck and they may not seem like opportunities, they are. With proper support, clients can emerge stronger. Absolutely. And that's what we want. We want to empower folks. So taking it further, so us as social workers can use these opportunities to improve our practice and experience. Absolutely. So in crisis moments, social workers serve as anchors, providing stability when clients feel most adrift. We can be that stability for them, especially when they feel like, you know, hopeless and lost and they don't know what to do. Any questions? Thank you all for watching my presentation. I appreciate it. And these are my references.